Hi everybody, today I am going to discuss a very strange, interesting and confusing disease which I am sure most of you won't know about it. Today my topic of discussion is kleptomania. This is the recurrent inability to resist urges to steal items that you generally don't really need and that usually have little value. Kleptomania is a rare but serious mental health disorder that can cause much emotional pain to you and your loved ones if not treated. Kleptomania is a type of impulse control disorder, which is a disorder that is characterized by problems with emotional or behavioral self-control. If you have an impulse control disorder, you have difficulty resisting the temptation or drive to perform an act that is excessive or harmful to you or someone else. Many people with kleptomania live lives of secret shame because they are afraid to seek mental health treatment. Although there is no cure for kleptomania, treatment with medication or talk therapy, which is also known as psychotherapy in our medical terminology, may help to end the cycle of compulsive stealing. Now let me tell you the symptoms. The symptoms of kleptomania may include inability to resist powerful urges to steal items that you do not need, feeling increased tension, anxiety or arousal leading up to the theft, feeling pleasure, relief or gratification while stealing, feeling terrible guilt, remorse, self-loathing, shame or fear of arrest after the theft, return of the urges and a repetition of the kleptomania cycle. Now let me tell you some of the features. People with kleptomania typically exhibit these features or characteristics which I am going to tell you now. Unlike typical shoplifters, people with kleptomania do not compulsively steal for personal gain, on a dare, for revenge or out of rebellion. They steal simply because the urge is so powerful that they cannot resist it. Episodes of kleptomania generally occur spontaneously, usually without planning and without help or collaboration from another person. Most people with kleptomania steal from public places such as stores and supermarkets. Some may steal from friends or acquaintances, such as at a party. Often the stolen items have no value to the person with kleptomania and the person can afford to buy them. The stolen items are usually stashed away, never to be used. Items may also be donated, given away to family or friends, or even secretly returned to the place from which they were stolen. Urges to steal may come and go or may occur with greater or lesser intensity over the course of time. If you cannot stop shoplifting or stealing, you should seek medical advice. Many people who may have kleptomania do not want to seek treatment because they are afraid they will be arrested or jailed. However, a mental health professional typically does not report your thefts to authorities. Some people seek medical help because they are afraid they will get caught and have legal consequences, or they have already been arrested and they are legally required to seek treatment. If you suspect a close friend or family member may have kleptomania, gently raise your concern with your loved one. Keep in mind that kleptomania is a mental health condition, not a character flaw, so approach your loved one without blame or accusation. It may be helpful to emphasize these points which I am going to tell you now, that you are concerned because you care about your loved one's health and well-being, that you are worried about the risks of compulsive stealing such as being arrested, losing a job or damaging a valued relationship. You understand that with kleptomania the urge to steal may be too strong to resist just by putting your mind to it. Treatments are available that may help to minimize the urge to steal and live without addiction and shame. If you need help preparing for this conversation, you should talk with your doctor. He or she may refer you to a mental health professional who can help you plan a way of raising your concern without making your loved one feel defensive or threatened. Now let me tell you the causes. The cause of kleptomania is not known. Several theories suggest that changes in the brain may be at the root of kleptomania. More research is needed to better understand these possible causes, but kleptomania may be linked to problem with the naturally occurring brain chemical neurotransmitter that is called serotonin. Serotonin helps regulate moods and emotions. Low levels of serotonin are common in people prone to impulsive behaviors. Addictive disorders. Stealing may cause the release of dopamine, which is another neurotransmitter. Dopamine causes pleasurable feelings, and some people seek this rewarding feeling again and again. The brain's opioid system. Urges are regulated by the brain's opioid system. An imbalance in this system could make it harder to resist urges. Coming to the risk factor. Kleptomania is considered uncommon. However, some people with kleptomania may never seek treatment, or they are simply jailed after repeated thefts. So some cases of kleptomania may never be diagnosed. Kleptomania often begins during the teen years or in young adulthood, but can start in adulthood or later. About 2/3 of people with known kleptomania are women. Kleptomania risk factor may include a family history, having a first-degree relative such as a parent or sibling with kleptomania, obsessive compulsive disorder, or an alcohol or other substance use disorder may increase the risk of kleptomania. If you are having another mental illness, for example, people with kleptomania often have another mental illness such as bipolar disorder, anxiety disorder, an eating disorder, substance use disorder, or a personality disorders. Now let me tell you the complications. Left untreated, kleptomania can result in severe emotional, family, work, legal, and financial problems. For example, you know stealing is wrong, but you feel powerless to resist the impulse. So you may be racked by guilt, shame, self-loathing, and humiliation. And you may be arrested for stealing. You may otherwise lead a moral, upstanding life and be confused and upset by your compulsive stealing. Other complications and conditions associated with kleptomania may include other impulse control disorders such as compulsive gambling or shopping, alcohol and substance misuse, personality disorders, eating disorder, depression, bipolar disorder, anxiety, suicidal thoughts, suicide attempts, and suicide. Coming to the prevention. Because the cause of kleptomania is not clear, it is not yet known how to prevent it with any certainty. Getting treatment as soon as compulsive stealing begins may help prevent kleptomania from becoming worse and prevent some of the negative consequences. Now let me tell you the diagnosis of kleptomania. When you decide to seek treatment for symptoms of possible kleptomania, you may have both a physical and psychological evaluation. The physical evaluation can determine if there may be any medical causes triggering your symptoms. Kleptomania is diagnosed based on your signs and symptoms. Because it's a type of impulse control disorder, to help pinpoint a diagnosis, your doctor may ask questions about your impulses and how they make you feel. Review a list of suggestions to ask if these situations trigger your kleptomania episodes. Our doctor may have you fill out psychological questionnaires or self-assessments. Use the criteria in the Diagnostic and Statistical Manual of Mental Disorder, that is DSM-5, published by American Psychiatric Associations. Now let me tell you the treatment. Although fear, humiliation, or embarrassment may make it hard for you to seek treatment for kleptomania, it is important to get help. Kleptomania is difficult to overcome on your own. Without treatment, kleptomania will likely be an ongoing and long-term condition. Treatment of kleptomania typically involves medication and psychotherapy or both, sometimes along with self-help groups. However, there is no standard kleptomania treatment and researchers are still trying to understand what may work best. You may have to try several types of treatment to find what works well for you. Coming to the medications. There is a little scientific research about using psychiatric medication to treat kleptomania, and there is no FDA-approved medication for kleptomania. However, certain medication may help depending on your situation and whether you have other mental health disorders such as depression or substance misuse. We may consider prescribing an addiction medication called naltrexone, which is an opioid antagonist, which may reduce the urges and pleasure associated with stealing. We also may prescribe an antidepressant, specifically a selective serotonin reuptake inhibitor, that is SSRI. Other medications or a combination of medication may be prescribed also. If medication is prescribed, ask your doctor, mental health professional, or pharmacist about potential side effects or possible interactions with other medications. Coming to the psychotherapy, there is a form of psychotherapy called cognitive behavior therapy, which helps you identify unhealthy negative beliefs and behavior and replace them with healthy positive ones. Cognitive behavior therapy may include these techniques which I'm going to tell you to help you control kleptomania urges. First technique is covert sensitization, in which you picture yourself stealing and then facing negative consequences such as being caught. Second is aversion therapy, in which you practice mildly painful techniques such as holding your breath until you become uncomfortable when you get an urge to steal. Third is systemic desensitization, in which you practice relaxation techniques and picture yourself controlling urges to steal. It is not unusual to have relapses of kleptomania. To help avoid relapses, be sure to stick to your treatment plan. If you feel urges to steal, contact your mental health professional or reach out to a trusted person or support group. Well, I hope you like this interesting video of mine today. And if you have kleptomania or if you are suffering from any other illness, please post your comments and I'll try to reply your comments as soon as possible, or if possible, if I get a time, I'll make a video on your illness.